Yes, my name is Mungai, as George has stated, and I'll be presenting for Samburu County. As you're all aware, Samburu is a huge county, around almost 22,000 square kilometers. To put that into perspective, Nairobi is 691 square kilometers. So it's a vast county, nomadic cultures, and we had numerous challenges with access to visibility of commodities at the community level. Our main the problem statement that we actually identified was there is poor linkage between the health facility and the community. And the community health services was aimed at improving the health outcomes of the community by having early community-based healthcare interventions through CHV so as to treat various minor health conditions at their onset and reduce the need for referrals for conditions which could have been easily identified and treated at the community level. And we've actually realized that within the county, the referral system is a challenge due to geographical access, geographical isolation, the distances between the community and the link health facility. And in some instances, the distances between each health facility could be an average 50 kilometers. So you can imagine if the CHV can intervene at the initial stages, that will greatly reduce our costs instead of dealing with emergencies. So that was one issue we had seen. The second was CHVs, being volunteers, have a lot of duties they perform in their communities, and they end up using the time they would have used to do their personal family duties to serve the community. Okay, they need motivation from their families, communities, and county governments to improve their zeal to work. So you find that currently the CHVs we have in Samburu, there is no stipend. So you can imagine someone going out of their way to reach different households. Maybe one CHV has 50 households, and these households they are nomadic. Today they're here, tomorrow they have shifted. So, and we realized that part of this was identifying CHVs who have the heart and the will and the passion to go and do this job without any stipend coming through. But of course, there are some measures we have taken as a county to address that motivation. And the third problem statement was CHVs were not issued with commodities because there was a lack of accountability for commodities, plus required commodities were not budgeted for by the county government. So that one we personally took as an initiative when we were doing our procurement for the HPTs. We factored in basic commodities, which we could actually issue to the link facility, and through the C-stock, we could actually have, it was the answer for visibility at the community level. And it has greatly helped. And for us to actually make it, operationalize it, we had to do some letters from my office to each of the sub-counties, detailing that it's okay to give these commodities, and we identified the basic commodities which we could supply through the link facility, the CHVs. And through C-stock, now we have that, created that accountability aspect to know what is moving, what is being consumed, and the mobility patterns. And we actually, the data was actually informing us on what to actually stock going forward. So we had the developmental evaluation, and as you can see, there were 3 waves: wave 1, wave 2, and wave 3. And for the community health strategy, which was wave 1, we are actually now looking at the CHV recruitment, because we need someone who is willing to actually go out of their way to travel on average maybe 20 kilometers per day on foot to address, to reach out to the communities, the households, interact with the households, see what the challenges are, come back with information to the health in charge, the link facility. And you can imagine that journey. It's not easy. Samburu is, of course, there are some hostile areas, there are wild animals in between. There is no the water, there is no geographical access, rough terrain. But now we had to identify CHVs who have the passion to do this job. Then also, we also had to talk to the CHVs to also give them guidelines on how to approach the challenges they were having as they go towards these communities, which are, as I said, they're really dispersed. Yeah. And then also looking at the modalities of what commodities do we give, because we have to take into account the literacy levels of the CHVs. There are some who are literate, some who are not literate at all. So it actually determined what commodities can we give, what quantities can we give. We had to actually limit some of the quantities. For Samburu, this program was very important and really helped us with our access. Now wave 2, as you can see, I think you can see the area of focus there was creating sustainability and community-based distribution. And also COVID came, we had to actually issue masks and also train the CHVs on what to do, provide them with sanitizers, just to make sure that at least they're comfortable interacting with the various households. Then the wave 3 now was understanding the barriers which were hindering or which would have affected our community-based approach and how to mitigate them. And then the importance of the CHARs, dealing with the CHVs. And also what was key was now the communication. Without communication, bottom up, top down, at least it helped us go forward, especially the bottom up. Yeah, so I think I'll go to the results. Of course, we identified those CHVs who have that passion. Of course, we tried our best and we did our best through the impact teams to make sure there was an uninterrupted supply of commodities where we could intervene. Some of the commodities were out of our control. Of course, we do procure from, and I won't go into that one for now. Now, in fact, even I had issues. I called the camps, I told them I need drugs. They told me, go and talk to the military. So we are yet to cross that bridge, but we'll see the way forward. Then, of course, recognizing the positive impact the CHVs have had. And we have actually seen and we empowered, we have actually rewarded, recognized them. I think we've even issued some certificates, some awards to some of these CHVs who have actually done and gone out of their way. And this has actually had a ripple effect towards the other CHVs. It actually gives them that energy and that impetus to go the extra mile. And then also the wave 3, increased uptake of professional services. We realized there's improved outcomes as a result of this, and the communities are more curious to know what's going on and actually seek professional health services. Considering Samburu we have a lot of traditional medicine, traditional healers. Each wave of activity was disseminated to the county team. Also, the CHMT was involved and the executive was informed of the progress that we're making. And actually, you could see from the data that there was actually improved outcomes going forward. But what I would say is the key thing here was the communication and also dissemination of our activities, the impact teams. We meet at the sub-county level, they meet monthly. At the county level, we actually call each of the sub-counties and we have our county commodity security technical working group meetings, which we hold quarterly. And in those meetings, we actually interrogate, we challenge. And I think I was in that room where we were going around the different stations, and I think one of Ken showed me some data. And they're telling me some of the data here, there are 4 facilities which did not report. And I could confidently tell him, I know, because these 2 facilities, 1 had an accident, 3 went on maternity leave. And actually, because of the impact teams, I could drill down to each facility and had visibility of what is going on in those facilities because of this program. So, in short, I have answers for all our problems, but not the solutions yet. That one is work in progress. So, one of the challenges we are having is competing activities in the county. You want to call these particular officers, but other partners have pulled them. Then, Samburu is vast. You have to plan ahead. And if you pull out some people from particular facilities, it's an issue because they won't give service. So, lessons learned. Training of CHVs is inconsistent and mostly partner-driven, which we want to change. And lack of financial compensation for CHVs reduce their motivation to work. I'll be happy to mention that Samburu County, we actually have a CHS bill, which has been passed by MCAs. We had to pull them out of Samburu somewhere, talk to them, I think in Nakuru, and house them and everything, and they agreed, and they passed it. And I think 2 weeks ago, a bill was done at the county assembly, which has now put aside 50 million for CHS activities. And I think beginning end of December, each CHV now will be getting, I think, around 2,000 shillings. So that's a big step. And you can clap for us. Tumejaribu. So that is now, I think, as Yasmin has been drumming to us, sustainability. Yeah. So that's one of the measures that we have taken to sustain this kind of engagement. Then again, huge distances between households discourages some of the CHVs from accessing all homes. And of course, the poor health-seeking behavior and reliance on traditional healers, which I mentioned, was a challenge as well, changing that mindset. But it's work in progress. It is possible, and we have done it, and we're still doing it. And so the last one, C-stock rollout was not done to all community units. Hence, the morale for CHVs was reduced, because some of the CHVs who actually where the C-stock was active, you could see they are more engaged, and they are moving, and they are excited. But now some of the CHVs who in other units where it's not done, they were asking why is it there and why it should be in my unit as well. So that was a positive for us, because we realized, okay, we actually need to scale this up. And I think we will engage with the director and the executive to see how we can now roll it out. And I think one partner, maybe I'd like to mention, one of our partners is interested in actually taking up, because right now C-stock is only in 2 sub-counties. We have 3 sub-counties in Samburu. It's only in 2. So we want to take it to Samburu North, where Baragoi area. So we want to see how they can engage and plug in and actually take it up, and we continue. So we won't stop going forward. And this will actually help Samburu County because of our unique challenges. And I think I'll stop there. So thank you very much. Yes.